नमामि रामं रघुवंशनाथम्. I am Dr. S.K. Singh, ex-Deputy CMO CCL. Now I am here to tell about a fever, that is malarial fever. Dear friends, you know very well that winter season has gone and this is summer season. Temperature is raised and mosquitoes are seen each and everywhere nowadays. Even in your car, bus, train, and your buildings, in your duplex, all where mosquitoes are found. And these mosquitoes become dreadful and dangerous when they carry a plasmodium. That is a plasmodium of malarial fever. You'll be surprised to know that this plasmodium is unicellular and it is highly infective. When infected mosquitoes, that is Anopheles, female Anopheles, sits on the body of the person, it pours the plasmodium in the bloodstream of the person and you will suffer from fever. It is better to narrate that there are four types of plasmodium: Plasmodium ovale, Plasmodium malariae, Plasmodium vivax, and most lethal Plasmodium falciparum. You will surprised to know that Plasmodium falciparum जानलेवा है. प्लेज्मोडियम फेल्सिपेरम से ही होता है ब्रेन मलेरिया, जिसको कहते हैं कि मलेरियल फीवर ब्रेन में चढ़ गया है. देन इट इज वेरी मच डिफिकल्ट टू ट्रीट. मैनी टाइम्स पेशेंट गेट्स लॉस and you will not get better result even you are giving the better medicines of malaria. These are the resistant communities which developed as per the progress of the time, and now people suffer from four types of malaria. In Jharkhand and Bihar, Odisha, Bengal, Plasmodium falciparum is commonest. We have seen so many patients suffering from Plasmodium falciparum, and so many resistant cases are found, and finally we get very much difficulty to cure the patients. How can you say that a person is suffering from malaria? A simple antigen based test is available, but this is not reliable. Only 30 to 40% cases can be detected, but more than 60% cases are not detected in any test. It is the wisdom and experience of the doctor who can recognize that it is a case of malaria. Jaundice can occur in the patient of malarial fever, and that is P. falciparum. Plasmodium falciparum does not go into the liver cell. It resides in red blood corpuscles, and after bursting of the RBC bilirubin they will rest, and that cause malarial jaundice. This Plasmodium falciparum crosses the blood-brain barrier and it goes to brain. Dimagi bukhar, dimagi malaria is possible. Nowadays, when the winter has gone, mosquitoes are prevalent in our community. We should be careful about the dreadful action of such malarial fever. I had told that malarial fevers are of four types. Four types of plasmodiums are found. Plasmodium falciparum, the most lethal in malaria. Next three, Plasmodium ovale, Plasmodium vivax, and Plasmodium malariae. Jaundice is found only in Plasmodium falciparum. Hot stage and cool stage. Temperature rises sharply, and after switching, temperature lowers down. So, we must know the nature of malarial fever. Hot stage and cold stage is found along with fever. But sometimes you will see only cold stage is found. In our experience, there is only cold stage, not hot stage. Patient shivering, and sometimes if patient suffering from Plasmodium falciparum, there will not be cold stage in hot stage. There is only continuous fever. Please mind it. मैंने जैसा कहा कि हॉट स्टेज कोल्ड स्टेज आएगा, बहुत ज़्यादा बुखार हो जाएगा, फिर पसीना दे करके छूटेगा. बट इन फैल्सिपेरम इट इज कंटिन्यूअस फीवर, ये लगातार बुखार आता है. फीवर मे कम्स ऑन अल्टरनेट डे आफ्टर 2 days, और फीवर मे कम ट्वाइस इन ए डे, और फीवर में भी continuous. There is no hot stage, there is no cold stage. Fever may be accompanied with jaundice, and the physician gets difficulty. Sometimes illusion is created that fever with jaundice, how to treat? It is notably difficult task. We use chloroquine, we use quinine, we use artemisinin, tablet of artemisinin injections. Artesunate injections are also made available in our society. We must know how to treat these patients. Sometimes patients get jaundice and urine is black. Black water fever is also known as malarial fever. In finding spleen and liver size increased. In these conditions, we must start anti-malarial drugs. But in my experience, most accurate medicine which is acting on falciparum is quinine sulfate. Each tablet contains 300 milligram. Two tablets thrice a day for 5 to 7 days should be given, and doxycycline 100 milligram capsules or tablet is very effective against these. That should be given morning, evening for 14 days. But if malaria is not of P. falciparum, it may go in the liver, and after the treatment for the liver where infection resides, we are forced to give Primokin for 15 days. In this way, we should recognize the malarial fever, but we should be careful about such type of mosquitoes which are causing malarial fever. We must use net, we must use cream. Mosquito repellent cream is available in our society. In our society, mosquito repellents, blackheat is also effective against mosquitoes. Quinol and liquids are also useful when we use it in where